This is a reading from the book Treat Your Own Chronic Pain, the Chronic Pain Bible for doctors, psychologists and clients. Some health professionals assume that because it's so clear that a psychological component is involved in experiencing chronic pain, that this refers only to thinking and emotion. But this falls very far short of the truth. If you are a sufferer of a certain kind of chronic pain, which happens to be the majority of chronic pain's presentations, then your brain has learned, using quite well-known and well-understood neurological processes, to produce real, actual pain signals. This is why no drug, no physio, no device, no CBT or DBT or mindfulness or anything else that has been thrown at sufferers has yet eliminated or even significantly decreased chronic pain for the majority of people. Study after study shows that none of these perform significantly better than placebo, which is to say they don't significantly perform at all. I am very far from alone in making this claim, and the scientific commentary and citations throughout this book demonstrate and validate this claim comprehensively. This is why it's absolutely not your fault if you still have pain, and it's not the fault of your thinking or your attitude. It's cruel and nonsensical to claim such a thing, and yet this blame, spoken or implied, forms the basis of many chronic pain programs, even now when we should all know better, because the cold hard evidence shows again and again that these programs simply fail to reduce pain for the overwhelming majority of chronic pain patients. Reducing so-called catastrophic thinking or improving your attitude does not reduce pain. So well-meaning therapists are quite wrong when they tell you it is some flaw in your thinking or your attitude that is to blame for your suffering. That stuff comes from Buddhism, not science, but unfortunately has permeated the entire field of psychology, which is supposed to be a science that delivers treatments based on actual evidence of effectiveness, not on unproven or disproven philosophical concepts or unverified theoretical frameworks. Another wild claim is that your suffering is because you don't understand your chronic pain, and that if you only understand that chronic pain doesn't mean there is necessarily any physical damage, and if you only stop carrying on about it, catastrophizing that is, you will suffer less. This claim is also deeply wrong, and the available research, which you'll read about shortly in detail, clearly demonstrates the uselessness of pain education for chronic pain sufferers in terms of actually doing anything significant about the pain. Of course you deserve to know the truth about the nature of your pain that is so out of kilter with any existing pathology that is not actually due to physical damage, but knowing this truth does not equal pain relief. Pain education is a humane thing to do so that you're fully informed and you know what's going on, but it is not in any way treatment or a cure. If we can only leave all that nonsense behind and apply proven strategies such as SDR therapy to treat chronic pain, we will switch off the pain and the suffering along with it. I hope you'll read this book with patience and glean heavily on the support videos, the webinars, and the community group where I'll do my best to answer questions and provide whatever help I can. These are all free, so please make full use of them.